Hello, I'm Matt Galloway, and this is the Current Podcast. About 3 of every 100 people will experience an episode of psychosis in their lifetime. They lose touch with reality, they might hallucinate, speak incoherently, behave erratically. Overall, rates of psychosis in Canada have been relatively stable, with the exception of one notable group: young people. New research in the Canadian Medical Association Journal has found there's been a substantial increase in the number of people aged 14 to 20 being diagnosed with psychotic disorders compared with earlier generations, and researchers believe that cannabis may be one contributor to that. Dr. Marco Solmi is a clinician investigator at the Ottawa Hospital. He holds a chair in evidence-based mental health at the University of Ottawa and a co-author of this report in the CMAJ. Dr. Solmi, good morning.
Good morning.
Tell me what you found about the increase in psychosis in that young age group, people between the ages of 14 through 20.
We have conducted what is called a birth cohort study, which essentially means that we follow up people that were born in different years. And so what we have observed following up people, more than actually 12 million people in Ontario, we have seen that in the age group that you mentioned, 14 to 20 years old, there are increased rates of incident psychosis. What does that mean? It means new cases of people showing psychosis.
And when you say showing psychosis, what specifically are you talking about?
That's a good question, because one thing is schizophrenia, another thing is psychosis. So schizophrenia is a disorder that is characterized by symptoms presented for at least 6 months, and frequently it's associated with many negative symptoms as well, which are, for instance, social withdrawal, not interacting with people anymore, not going to school anymore, not going to work anymore, a blunt affect, as well as they speak very little. And so these negative symptoms frequently precede the onset of schizophrenia. In psychosis, they can be present, but can also not be present. And psychosis can be a little bit briefer in time, shorter in time. And frequently, there are also other factors associated, such as a triggering factor, precipitating factors. And one of those is typically cannabis use.
Tell me more about that and the connection that you see between the use of cannabis and an increase in that age group of people showing psychotic behavior.
The connection between cannabis and psychosis has been studied extensively across different lines of research. So finding an association does not mean that there is a causal connection between a risk factor and a given health outcome. However, when we find different sources of evidence, different study designs, all together consistently pointing in the same direction, which is cannabis being associated with psychosis, then we need to account for that when we talk to our patients, as well as when we design policies.
You were asked as part of the Canadian Medical Association Journal podcast how often you, in your own clinical practice, would see cannabis contributing to psychosis. And your answer, these are your words, that it's the rule rather than the exception. Tell me more about that and what you're seeing.
So I work in a first episode psychosis clinic in my city here in Ottawa. And we do see that the vast majority of people that present to our clinic have used at some point cannabis, and frequently it is involved around the presentation of the first episode of psychosis. We've also recently completed a meta-analysis that we will submit in the coming weeks, I think, that measured the prevalence of cannabis use and cannabis use disorder in those with first episode psychosis globally. So this is across the globe. And we found that more than 1 person out of 2 have a cannabis use disorder in first episode of psychosis. And we also found that in countries like the US and Canada, the rates are higher than other countries where cannabis is not commercialized. I think the problem in Canada potentially is the wild commercialization of cannabis, not necessarily the legalization of cannabis. And I can elaborate more on this.
Have you seen, well, tell me more about that. Have you seen an increase in what you're seeing in your clinic between presentations of psychosis and a connection between cannabis use since cannabis was legalized in 2018 in this country?
So I've not seen it with my eyes because I moved to Canada in 2021.
Right.
So I cannot speak for my clinical experience on that. I can tell you, though, that comparing with the country where I come from, which is in Europe, Italy, here in Canada, I see definitely much more cannabis use involvement in the first episode psychosis patients. We have also done quite a lot of research using the same database that we use for this study we're talking about today. And we have shown that rates of cannabis use disorder involvement and substance use disorder involvement in general, but cannabis use disorder in particular, before the onset of first episode psychosis has sharply increased in the recent years, which means that we see less people with quote unquote clean schizophrenia presentation without any substance use involvement. And we see a much larger proportion of people that end up developing schizophrenia down the road with earlier stages with involvement of cannabis use before the onset of schizophrenia.
What do we know about what's happening in the brains of those young people for cannabis use to, if your theory is correct, lead to increased psychosis?
Yes, and again, these are associations, and you're right. I mean, we cannot claim there is a causal association, and though again, when we put the different pieces of evidence together, there's a strong signal there. So there are neuroimaging studies. Neuroimaging studies essentially take pictures of the brain, and they show what's going on with the brain when they are exposed, for instance, to cannabis. And these studies show that there are similarities between what cannabis does to the brain, in particular increasing dopamine release in certain brain areas, but other neurotransmitters involvement as well, and what happens in the brain of people with schizophrenia.
Your co-author has suggested, Dr. Daniel Myron, that perhaps the regular use of substances during adolescence drives a rewiring or structural changes in the brain. What do we know about that?
So why are we particularly concerned with young people? Because the brain is still developing up to age 25, roughly. And so when young people expose their brain to substances before age 25, in particular age 14 to 20, for instance, they are exposing an evolving organ, an evolving part of their body to a substance that is very, very active on that specific organ and those cells. And so obviously, because there are still processes that are developing, such as pruning, so rewiring of and building of the connection systems in the brain, and obviously, if a very active substance tugs into that can alter things, and things in some individuals can go badly, unfortunately.
Do we know how much cannabis one needs to use to trigger those effects?
So no, we do not know. We do not know. So that means that we cannot say what is a safe amount of cannabis. We can say that certainly using cannabis before age 25 is very, very dangerous. And the problem is that, at least what I see in my patients, is that they do not know the potential danger that they're going to face by using cannabis. So this means that people, when they come to my office and we talk about cannabis, and I tell them about the risks associated with cannabis, they have no clue. They say, "Doctor, nobody told me that. I thought it was just, having some fun," but they were not aware of the risk of psychosis associated with cannabis, unfortunately.
What concerns you about that? I mean, and I understand that you weren't here in 2018 when cannabis was legalized, but cannabis is much more widely available now. And there's been a normalization, a mainstreaming of the use of cannabis since that point. And there are doctors here, there are doctors in the United States who say that we never really understood what the impact of that could be. And they have talked about how we broadly are living through some sort of uncontrolled social experiment because this drug is available and we don't know what the outcomes of it are. What concerns you about that?
I would agree with this view that this is kind of an experiment, but young people in particular, are paying the price with their mental health, unfortunately. The problem is also that families do not have any leverage with their kids to advocate or to make them reason not to use cannabis, because families of my patients, the most frequent answer I get is that they told me that their son tells them it's legal, mom, or it's legal, dad. So what do you want from me? You buy some beers, I buy some weed. So what's wrong with that, right? And so that sort of neutralizes any leverage also of the family in trying to reduce the use of cannabis.
I have to let you go, but just very briefly, what would you want those young people and the physicians who are treating them to think about in light of your research? Again, there are questions that are still to be answered, but based on what you are understanding now, what do you want them to think about?
What I would want them to think about, the young people and ideally also regulators, is that, again, the brain is still developing up to age 25. And so at the very least, there should be labels warning people about the risks of cannabis. And for clinicians as well, making sure that the narrative that is widely heard around, which is that cannabis can treat anxiety or something like that, that's not evidence-based. Cannabis might have some role in treating muscle spasticity, multiple sclerosis, maybe chronic pain, but there's no evidence it has any beneficial role in mental health. And actually, it worsens mental health and also cognition at an age where people have to complete their studies, have to complete their education, they're setting themselves up for success for the coming years. And so that's a particularly vulnerable age for young people. So short message is, do not use cannabis. That's a dangerous substance. And you maybe use your time otherwise.
Dr. Solmi, good to speak with you. Thank you very much.
Thank you so much.
Dr. Marco Solmi is a clinician investigator at the Ottawa Hospital, holds a chair in evidence-based mental health at the University of Ottawa, and co-author of that new report in the Canadian Medical Association Journal. Dr. Oyedeji Ayonrinde is a consultant psychiatrist in community mental health, professor in the Department of Psychiatry at Queen's University, and division chair and clinician director for community mental health at Providence Care in southeastern Ontario, and has been listening in. Dr. Ayonrinde, good morning to you.
Good morning.
What do you make of the findings from this study? Particularly, again, there are questions to be asked, but there are the finger is being pointed at cannabis in some degree here.
Yes, it's a very interesting study, and what we learn from the timeline is it gives us an opportunity to reflect on trends, but not only trends, but trends across different age groups. And the earlier speaker did emphasize the concerns with younger people and youth. The link with cannabis is one we should take seriously for a multitude of reasons. It's not new. The concerns regarding this association between cannabis use and mental illness, particularly psychosis and schizophrenia, isn't new. However, the emphasis and the reinforcing of the messages and better targeting the risk periods is really important for us.
You have done work on expert panels and have written extensively about this. There has been, as I said, a normalization of cannabis use in this country right now. What is the impact of that?
The normalization is a concern. And if we look at the Canadian Cannabis Survey, which has been carried out year on year, the attitudes towards cannabis and harm have shifted over time. So a lot of people actually perceive cannabis to be less harmful than tobacco and less harmful than alcohol. So the perception of risk and risk of harm can influence attitudes as well. Cannabis is available, is ubiquitous, it's available everywhere, whether licensed products or from illicit sources. And may I emphasize quite early in this conversation, there's no singular entity called cannabis. Cannabis is like saying dog or flower. Are we referring to a Chihuahua, or are we talking about a Rottweiler or an Irish Wolfhound? And the implications of that is the active component that is of greatest concern to us is something scientifically referred to as delta-9 tetrahydrocannabinol, commonly known as THC. And THC content can totally change the behavior of cannabis products. So there's a difference between THC content of 5% in some forms of plant product compared to THC contents that may be up to 90% in products, for instance, referred to as shatter or infused products. So singularly, there's no single cannabis, and hopefully with our cannabis literacy, awareness, and so on, we'll be referring to, just like with alcohol, beer and spirits, recognizing the difference.
In the meantime, talk about those young people who are, according to this research, experiencing increased episodes of psychosis. What are they going through, the people in that cohort between 14 and 20?
It's a very difficult period. We know that, for instance, from grade 7 to grade 12, there are increasing rates of anxiety in youth. We know that grade 7 to 12, the increase in rates of self-reported stress and depression in youth. And it's that same curve that the increase in cannabis use does increase as well. Youth with developing brains, as we heard earlier, do explore, like we've all been there. Yeah. And the brain of the youth is like a construction site, trying to make order and sense of the world around it. So it's particularly difficult when quite a number of youth also use cannabis symptomatically to try and improve their sleep, their anxiety, their worries in a world that's getting more and more chaotic around them. And it becomes normalized in youth culture. And because many people know people who've used cannabis and felt slightly better, I put that in quotes, or more relaxed, it becomes normalized. And when people then start having emergent psychotic symptoms, becoming paranoid, isolating, not engaging with other people, attending school less, reduced memory, and cannabis does affect attention and concentration, therefore memory. And the child and young person gets more detached, starts behaving a bit more oddly, and so on. These can be early warning signs that could be missed, or people may attribute it to adolescence. Oh, it's just adolescence. But it could be quite concerning signs of emergent psychosis.
What do you say? We just have a couple of minutes left. Let me ask you a couple of quick things. One is, what do you say to people who, they've heard this story before? I mean, in the 1960s, it was reefer madness. Do you know what I mean?
Yeah.
When cannabis was legalized in 2018, we had a lot of these conversations, and people said, it's not addictive. You can't develop psychosis. Those are concerns that aren't attached to the use of this drug. What would you say to people who believe that?
I would say in a study we carried out recently here, 83% of youth attending the early psychosis program self-reported cannabis use. 83%. And it wasn't that they were just saying it, because when we did urine toxicology, close to 80% tested positive for cannabis. We would say reefer madness, I'll use that again in quotes, the cannabis then is very different to cannabis now. Yeah. Cannabis potency has astronomically increased. The concept of good weed being high-potency weed sort of misleads about risk. And I'm very pleased to say Health Canada has reintroduced the psychosis and schizophrenia warning labels on cannabis packaging last year. So the packages, the messages and the warnings are true. The impact on young people in critical years of life can be devastating with a psychotic illness. Dreams, aspirations, and the rest lost.
And so finally, just briefly, what would your message be to young people? They hear this. This is a story about a legalized drug, but it's also about young people. And to your point, what those young people are going through. What would be your message coming out of this report?
I would say to young people and parents and caregivers, let's talk about cannabis openly. It shouldn't go in the shadows. In a world where AI is challenging reality testing and people may not even know they're psychotic, that we should create structures to talk about it. Let's speak about it in schools, universities, at home. Cannabis smoke should not be hidden.
This is fascinating, and the subject, I think, will be the subject of a lot of conversation as well. Doctor, thank you very much for being here.
You're most welcome. Thank you.
Dr. Oyedeji Ayonrinde is a consultant psychiatrist in community mental health and professor in the Department of Psychiatry at Queen's University. You've been listening to The Current Podcast. My name is Matt Galloway. Thanks for listening. I'll talk to you soon.